and welcome everyone. We're thrilled you're here for Reimagining Aging, the science and impact of Zing Performance in age-friendly care. I'm Rayanne Melton and I'll be your host today. Before we begin, a few quick housekeeping notes. We're recording today's session. We'll email the recording to all the registrants. Please use the Q&A panel for your questions. We will be responding to questions via email after the webinar. If you have technical issues, use the chat box to message our team. At the end of the webinar, we will share a QR code for information about how you can register for the Axxess Growth, Innovation, and Leadership Experience. We call it Agile, the premier industry conference on technology and AI in the care at home space, taking place in Dallas, May 4th through 6th. We're here today to discuss the importance of age-friendly care for elder Americans and how cognitive interventions provide improved patient outcomes that address what matters most, mentation and mobility. Before I introduce our speakers, let's take a moment to review some of the data around cognitive decline in older adults. More than 6 million Americans live with dementia today. That number is expected to double by 2060. Among adults 65 and older, 22% have mild cognitive impairment, and 1/3 of them develop dementia within 5 years. And 1 in 4 of these people fall at least once each year. With this information in mind, let me introduce our panel of experts. First, Teresa Harbour, the COO of Community Health Accreditation Partners, known to most of us as CHAP. Teresa brings many years of experience in the care at home space and has been a leader in advancing age-friendly care through measurable outcomes and scalable workflows. Next, Steve Chandler, account manager at Zing Performance. Steve is an expert in neurocognitive performance and will share the science behind how Zing supports cognition, balance, and confidence for older adults. And joining us from the provider perspective is Jeff Brown, CEO of Millennium Home Health and Hospice. Millennium is an active Zing Performance customer, and Jeff has led his organization in integrating innovative therapies like Zing to improve outcomes, engagement, and care quality. Teresa, to set the foundation today for our conversation, can you share a brief overview of age-friendly care and why it matters?
Well, Rayanne, I struggle keeping this brief because I'm very passionate about age-friendly care, but I'll do my best to make it brief. So this was an initiative from the Johnny Hartford Foundation, IHI, the Institute for Healthcare Improvement, AHA, the American Hospital Association, and then the Catholic Health Association as well. They came together, did a lot of research around what are the unique needs of older adults. And so they determined it was this, 4M framework. What matters, medication, mentation, and mobility. We were very fortunate enough to receive a grant from the Johnny Hartford Foundation. And that grant allowed us to look at age-friendly health systems and how to bring this 4M framework from the hospital setting to the home setting. So we pulled together industry experts and leaders. We had large groups like, Bayada, Accent Care, Inhabit, Compassus, LHC, Aviana, Right at Home, First Light, Axxess, NOC at the time, and NHPCO, and then HCAOA. In this group, we met on a monthly basis and just looked at, once again, how to bring the 4M framework from a hospital setting to the home setting. So, why this matters is evidence-based care. It has been shown to decrease cost of care, to improve patient outcomes, to improve patient satisfaction, and also clinician staff satisfaction, because they're able to see that improved quality of life in their patients that they care for. At CHAP, we've actually seen a decrease in our number one deficiency, which is across home health and hospice, not having individualized plans of care. We see that typically cited in 33% of the time. For those organizations that go through age-friendly care certification, that decreases down to 6%. So a lot of good things that we're seeing, both from that aspect, but also when we go on site to make home visits as well.
Wonderful. I'm a big fan of age-friendly care. And before your next question, Teresa, I just want to thank CHAP for, making it easy for your partners, your clients to get certified in age-friendly care through CHAP. I think it's a big help to all of the home health, home care, home hospice agencies around the nation. So another question for you, in your experience, what is the impact of improved cognition when the 4Ms are built into clinical practice?
Well, the 4Ms are the 4Ms, so they're very connected to each other. So when you have any type of improvement in any of them, it impacts the other. So if you have improvement in cognitive functioning, then you're going to have, an improvement in, medication adherence. You're also going to have an improvement in just maintaining your independence because they are so connected.
Correct. So that really rolls us right into Steve's question. And I expect that many in our audience are unfamiliar with the great impact that Zing Performance provides to older adults with cognitive decline. Please give us a quick overview of what Zing Performance is and its history.
Okay, thanks for the question. Zing Performance is a UK-based company that has been around for 26 years. So over that time, they've built 4 modules that address different cognitive issues for specific populations. They have a program that is focused on trauma and high stress individuals that are experiencing high stress, PTSD, those types of individuals. They also have a module that is directed towards ADHD and learning issues. Then they have a third module that is for sports performance. And the fourth is Sarah Skills, which is the one that is most targeted towards senior adults. So all of the programs that Zing creates are app-based. So that allows an individual to use the program at their schedule, at their pace, and be able to interact with it when it's convenient for them. Sarah Skills, again, is more specific to senior adults. It is a cognitive wellness program that has been clinically shown to improve memory, mobility, mental acuity, and balance. So all factors are all cognitive issues that are most associated with senior adults. So and the program for senior adults is covered by Medicare. So that's one of the most important aspects of our program, is that it can be covered through Medicare for senior adults. Now, as far as the history goes, I find it particularly interesting with how Zing got to where it is. Winfred Dorr is the founder of Zing Performance, and Winfred was an extremely successful businessman in England 26 years ago. His daughter struggled with dyslexia to the point of being suicidal. She did attempt to take her own life, and that was a real wake-up call for Winfred. So recognizing that he had a child that was struggling and needed help, um, his response was to sell all his business interests and dedicate himself to finding a solution for the problem that his child had. So he invested $19 million of his own money to develop the programs that we now have as Zing Performance. And they continue to do research. They continue to improve and develop the programs so that they address more of the cognitive needs of each of the populations that Zing serves.
So interesting. Can you walk us through the science behind Zing Performance and how it supports mentation and mobility? We'd love a snapshot of outcomes for older adults using a Zing.
Yeah, the basis of all of the programs uh, uh, is activating the cerebellum, stimulating the cerebellum. So cerebellum being a portion of the brain that controls mobility and memory. And so by developing a series of both mental exercises in conjunction with simple physical activities, simple physical exercises that they do at the same time in conjunction with the program, that stimulates the cerebellum to create new neural pathways and to be able to develop and improve memory, balance, mobility, and mental clarity. So
Right.
in all aspects of what they do. The program only takes about 10 minutes a day, so it's not time consuming. It's very simple for the senior adults to work with. Normally, the process that a senior adult goes through when they engage with the app, they do an 8-day assessment, and that gives us a baseline that they work against. Then they go through the program. The program is customizes for that individual. So the assessment determines the needs and the level that the individual is working at. And then as the individual goes through the program on a daily basis for 10 minutes a day, they start to see improvement. At the end of each month, they reevaluate. They go through another evaluation to see where they are in relation to the first evaluation. So, in relation to their first benchmark. And then they continue to repeat that process. So they go through it a month, then they're reevaluated another month, then they're reevaluated again. And the program generally runs for 12 months. You'll start seeing progress after about 3 months, significant progress after about 3 months. And then the program will generally go for 12 months. Medicare will pay for it up to 24 months if the patient continues to show progress. The most important thing about this is that this is not a program that you have to continue to engage with after that time frame is over. So once a patient starts seeing the progress, once the patient goes through the program, those changes are permanent, and they will continue to experience the benefits even after they stop the program. Although we do have people who it becomes a habit and they enjoy the program, and so they continue to use it. The program is coach supported. So we have coaches, we have over 700 coaches that engage with the participants, with the seniors as they go through the program. So there's always someone for a senior adult to engage with, to contact if they're having issues. The coaches also are proactive in calling the senior adults and just to make sure that they're doing okay and that their own, their own track. They do have bilingual coaches also, and they have a low impact version. So if you have patients who are unable to do maybe some of the physical exercises in the program, they have a low impact version for those seniors.
Great. So I just want to get a visual here. I have my cell phone. I open the app and I'm guided through the activities for 10 minutes a day. And you're getting that kind of a response.
Correct. We have the engagement rate that we keep through the program is around 75% for senior
That's
adults.
great.
So it is very high. And as far as results, it's interesting. I'm going to refer to another screen here so I get all of this right. A third-party study was just concluded. This was almost 12,000 participants. And again, this was third party that conducted the study, but the results and the areas that were tracked and the percentage of improvement over all of these categories, brain efficiency was an 83% improvement, memory recall 77%. Let me bring this a little closer. Response speed, 83%, auditory working memory, 51%, concentration, 82.7%, balance with eyes closed, 71.8%, decision-making, 72%, emotional control, 68%, and communication skills, 73%. So those we're
That's
blown
just pretty
away.
amazing. Pretty amazing
We are blown
statistics,
away with that.
right?
And the study will be it is queued to be published in a peer-reviewed journal in the near future.
Awesome. That's awesome. So Jeff, let's talk to you a little bit. Your organization integrated Zing services into your workflow. From your provider experience, could you share the driving reasons for Millennium's partnership with Zing?
Our agency leadership is so excited about remote therapies that can help our patients. Cognitive therapy has the potential to really help with fall risk patients, and we routinely admit patients who are a fall risk. And if we can help them through programs like Zing, that helps them and it helps us. It helps our agency in a number of ways. So we felt like it was a no-brainer. The aging population that we serve are not always real easy to convince that the cell phone is a valuable tool in their life. So that part of it's a little bit of a challenge, but we're working on that every day. We see real value, potentially huge value in this partnership.
And it's literally a simple connection between your clients and Zing.
They make it real easy for us. We have a referral sheet that we have them fill out, and we share that with Zing, and Zing reaches out and does the heavy lifting.
Wow, that's terrific. All right, Jeff, and what operational and quality benefits have you seen? I'm expecting you've seen a real decrease in falls. Would that be true?
It may be premature for me to say that. We haven't been at this for that long, but I can say what I've experienced, I've been in the field with my marketing team, where they had set up meet and greet with doctors, and when we mentioned that we have a partnership that helps us with cognitive ability and therapy,
Mhm.
we see real interest in that, and it's kind of sets our agency apart because we have that to offer.
Yes, awesome. And so I- have you seen, so it sounds like it's a little early to think about the operational and quality benefits that you may have seen. How's your staff reacting to it in general? Have you heard anything from the people that have the feet on the ground?
I would say that we have succeeded in convincing our staff that this is worthwhile and they need to be encouraging our patients to give it a chance. But to be able to specifically give examples of improvement, I don't have that information right now.
Okay, that's great. But I will say that's a big, being an old nurse myself, I'm going to say convincing nurses to embrace something like that is a huge achievement. So well done there. So we've heard about the benefits of age-friendly care and Zing Performance. Teresa, where do you see the strongest alignment between Zing and the 4Ms?
Well, and before I answer that, I just want to say I did download the app on my phone, and I did that for a few days. And I should actually continue to do that every day because it absolutely, I could tell that I mean, I did it too short of a period of time to see, any outcome from me, but just the exercises, I thought, oh my goodness, I really need to be doing this every day. But then, of course, I stopped. But it was so simple, though. I mean, if I always look at it that I'm always the test person. If I can do it and figure it out, then anybody can do it and figure it out. But it is very, the platform is very easy to use. So
Wonderful.
when you're looking at, Zing Performance and the 4Ms, I mean, it does closely align with really all the 4Ms. What matters, to the patients, the medication, making sure that they're taking their medications correctly. And anytime they're doing that, you're also looking at, mobility and changes in, cognitive functioning. But all of those are so, woven together and so connected to where when you have an improvement in one or a decline in one, it impacts the others. That with this, anytime that you can improve mobility, not cognitive functioning, you're going to impact all the M's altogether. And being able to focus on what matters and making sure that we are working with our patients and building that plan of care around that. And Zing Performance can definitely be part of that plan of care.
Wonderful. Thank you. Steve, how do you think neuro-based programs will shape age-friendly care over the next 2 to 3 years?
Yeah, I would just kind of build on what Teresa was talking about with the 4Ms. And it's interesting because if you look at surveys, and certainly the first M of the 4Ms is what matters to the patient. And if you, in fact, the John A. Hartford Foundation did a survey in their literature. They reference that cognitive decline is the greatest fear for senior adults. It is so overwhelming to think that you may start losing cognitive abilities. And there's another part of the survey that references what senior adults are looking for, and they are looking for solutions to that very problem. They want to find ways, technology, and it was specific to looking for technological ways to reduce cognitive decline. So that's the first M of what matters to the patient. And then when you look at the other M's, and in relation to the needs of home healthcare agencies, the medication management is one of the M's, but it's also from the perspective of an agency key for keeping their scores up. Because you're going to be judged on how well your patients do as far as medication management. The same thing with mobility. That is a big part of what we address. And then mentation, obviously, that's the core service that we want to provide for seniors. So we line up with all four of the M's. And I think that, the age-friendly healthcare initiative is already being implemented into the hospital environment. And I think the expectation is, in other words, they are required to report now. What are they doing? What are they doing to line their operation up with age-friendly healthcare? And I think it's a short jump to that level of integration being made to the home healthcare industry also. That's something that will be coming in the future.
Sure. Axxess and Zing have been collaborative partners for a few years now. Steve, Zing has been working closely with Axxess Business Intelligence Platform. Could you share an update on how the Zing Axxess integration will work moving forward?
Yeah, we are very excited about this, and I think Jeff is going to be very excited about this. As far as working with an agency and being able to make it easy and seamless and effective, and to not require more work on their staff. What we've been doing is integrating Zing as a referral from an agency, so that if in their reporting, in their putting their data into the Axxess platform, if anything triggers as far as cognitive decline or in any kind of issue around mental issues, or if they are a fall risk, as soon as those boxes are checked in the Axxess software, it will automatically refer that patient to Zing Performance. And so it will just be a very, very easy handoff, almost seamlessly. And then Zing will take over the process of onboarding that patient, getting them up as far as the app, downloading the app, getting them active on the app. And we take care of all of that. But on the front end, we're going to take the heavy lifting of the responsibility of the agency staff to make patients aware. It will be an automatic referral if they have certain cognitive issues or fall risk issues.
Great. And then Zing will be also closing the loop with the agencies to, or will there probably be a notification within Axxess?
Yes. They will be aware of what's going on, and certainly, we will still continue to build a relationship with the agency and make them aware of who we are and what we're doing and how we're helping their patients, because we want them to see the value, even though it is much more of an automated process as far as the referral goes. We want them to know who we are and how we're serving their patients.
Great. Well, I'm here at Axxess. We are all about the takeaway. So this is a question for each of you. Based on today's discussion, what is the one thing our attendees should do tomorrow? Teresa?
Well, I have a question before I answer that one too.
Okay.
Based on what you just said, Steve, so I am, say, a home health nurse, and I'm completing my OASIS, and part of that OASIS is, there's a BIMS, a CAM, PHQ-2. There's, fall risk, assessment as part of that. So if I
Correct.
heard correctly, so if I am doing that, evidence-based screening and completing that tool, and I identify, they score to where a referral would be made automatically through the Axxess platform to Zing. Did I hear that
Correct.
correctly?
Correct.
Correct. It will
See,
have their basic information, to let us put them into our system, and then our coach staff will reach out to them and let them know that that this has been recommended, and we will be the contact for Zing Performance and helping them integrate into our platform. What we want to be, what we want to look at ourselves as is an ancillary program that helps agencies do their core job better, and what they offer their patients, because either it's going to help improve your scores, which is financially beneficial to an agency, but it's also going to help with clinicians when they are working with patients. So if they are able to understand their uh, their medication management, if they are better able to understand their care uh, uh, program, then that's going to be easier for the clinician to work with that patient. There was a study that came out that was done by Bloomberg, actually, um, and Johns Hopkins, that showed the financial cost of home health care agencies dealing with patients that are struggling with cognitive impairment. And there is a dollar cost to that. There is a time cost to that. That it takes more resources, and it takes more time to engage with patients with cognitive impairment. So that's one of the things that we want to help address with agencies. But again, it's also helping to relieve the frustration that a lot of clinicians have in dealing with patients with cognitive impairment.
yeah, and anytime you can take that work off clinicians is great. As a clinician myself, we greatly appreciate that, and that's why with this 4M framework, that's what I love about it, is that it is a framework. It does not add work to clinicians. It's not a new program. It's an initiative to really provide structure for every home visit that you make. And so my answer to your question now, Rayanne, is, this is what I encourage everybody to ask. And this was given to me by one of our customers, and I use it all the time, because when he told me this, I thought, oh my goodness, this is such a good question. So I always encourage all organizations to go back at their next, case conference or staff meeting, whatever, when you've got a bunch of clinicians in the room, ask them, what do you focus on during a home visit?
Mm-hmm.
And so when he told me that he asked his team this, and I'm like, well, what did they say? He said it was just crickets. And so I was sitting there thinking, okay, now, if I was asked this when I was a home health and hospice nurse, what would have been my answer? And my answer would have been, oh, I focus on the plan of care. That would have been, I think I would have answered that way. I focus on the plan of care. I follow the plan of care. So that's what I do when I go into the home. But, I told him, I said, gosh, imagine if they just automatically said back to you, oh, I focus on what matters, medication, mentation, and mobility. The impact that would have had. And then they have that top of mind every single visit that they make in the home. And talking about moving the needle and improving outcomes of patients, the only way you're going to do that is get them involved in their care.
Absolutely. Absolutely. Thank you for that, Teresa. Steve, what's the one thing our attendees should do tomorrow?
I would hope that they would reach out to us, to Zing, and particularly me. I would I'm kind of on point with Axxess and the agencies, and let us share more about. I know this has been a short presentation. Hopefully, it's piqued people's interest. But we would like to talk to you more. We would like to share with you more about the app and how, and visually show you how a patient interacts with it and how easy it is for them, and again how easy it can be for an agency.
Great. All right. Last but not least, Jeff, what's the one thing they should do tomorrow?
Well, I don't know why they would wait till tomorrow. It's hard to see a downside here. And there's no competition between what we're able to do and what Zing does for the patients. So, and he mentioned the cost. We see that in so many ways. The patients who are in cognitive decline are the ones who call the office repeatedly. They're the ones who forget that the nurse said, I'll be here tomorrow. So they're calling and they're confused and sometimes even upset. So if this therapy can help alleviate even a few of those situations, it's just good for us. It's good for our patients. It's a great program.
Well, with that wisdom, on behalf of Axxess, thank you to our panelists, Teresa Harder, Steve Chandler, and Jeff Brown, and to you for joining today's webinar. Please take a moment to scan the QR code to register for the Agile conference, and look for an email in the next few days with a link to today's recording and Axxess's Agile landing page. It's been a pleasure. Thank you, everyone. Have a wonderful day.
Thank you for joining Axxess On Demand. Visit axxess.com for more on-demand videos, industry resources, blogs, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.